The countdown is underway to the United Nations Summit in September on the Sustainable Development Goals, SDGs. Observers say the new Sustainable Development Agenda builds on the success of the Millennium Development Goals, MDGs, which helped more than 700 million people escape poverty. The 8 MDGs adopted in 2000 aimed at an array of issues that included slashing poverty, disease, gender inequality, and access to water and sanitation by 2015. There has been progress, such as reducing maternal mortality in Africa from 870 deaths per 100,000 live births in 1990 to 460 in 2013, a 40% reduction. But challenges remain. Amina Mohammed is the UN Secretary General's Special Advisor on post-2015 development planning.
This is a moment in history where we are learning the lessons of the Millennium Development Goals and what we need to do to address existing challenges but new complexities in a universal agenda. And for us, 193 countries coming together to express what it is that we need to do to address that, amongst other things, not just the Sustainable Development Goals, but with the means of implementation and addressing the climate change. So 3 big actions, and this I think is at the core of it. It is about a universal agenda that is integrated. I think for the first time we're not putting a band-aid on the problem, we're looking at the root causes, and unless we make the investments to look at those root causes, we are going to continue to have the conflicts escalate, we're going to continue to see the damage in the environment, and more people are going to be excluded. Inequality is going to be a mainstay which is just not sustainable.
The cost of implementing the 17 Sustainable Development Goals is estimated at $170 trillion over the 15 years. Now, joining us in the studio for more is Kwame Fosu Louis, an African policy expert and health advisor. Mr. Fosu, welcome to Africa 54.
Thank you very much.
So let me ask you this. First of all, you heard what Mrs. Mohammed had to say. What is your reaction?
Well, my reaction to that is, first of all, yes, the Millennium Development Goals have in some way helped Africa reduce child mortality and improved maternal health. However, there's much to be done.
Absolutely.
And when we talk about moving, first of all, people should know what the MDG goals are. The MDG goals were created in 2000 at a conference of the United Nations, and the goals, it had 8 major goals to reduce poverty, empower women, and so on and so forth.
Yes.
Fundamentally, the MDG goals failed overall. We still have over 1 billion people living in poverty and earning less than $1.25.
But there have been also some progress made, such as a reversal in the rising trend in HIV and AIDS, incidence rate declining from 0.85 to 0.32 from 95 to 2012. So
sure,
this and other progress have been made.
Sure, I mean, yes, generally, and I believe in the course of any nation or in the countries, there would have been progress in these various areas.
Yes.
But we have some fundamental issues for sustainable development to really improve Africa and improve women's status in Africa. There have to be some fundamental changes.
Such as? And
those changes, one, are education. When we talk about improving health for women, it cannot simply be providing contraceptives to women. It has to be also fundamentally building schools for women. In the United States, there are several colleges that were built specifically for women because of this disparity when women were not actually going to college as compared to men. So we had Barnard, we have Wesley, and we have several elite colleges that were built specifically for women. Regarding the health sector as well, one major issue is breast cancer. Breast cancer.
Non-communicable disease in general.
Exactly. Breast cancer, the highest rates of breast cancer right now are in Africa for women. Well, the highest rates are in Europe. However, the highest rates of deaths for breast cancer are in Africa. And breast cancer is rising increasingly, and this is by the United Nations own report in 2012.
Yeah. So,
Yes.
so moving from the MDGs to the SDGs, what do you see as priorities? Very concrete examples, maybe one or two, because we don't have a lot of time.
All right. Concrete examples. First of all, we actually have to build hospitals.
Okay.
After $15 billion, over $15 billion spent on maternal health and over $10 billion spent on family planning, let's take, for example, Ghana. We don't have one new hospital to show for that. It is essential for any nation that's going to improve the health of a nation to actually build hospitals. We cannot just keep providing services and services from abroad that do not really sustain communities in Africa. Okay. Another specific issue is to have actual colleges and universities built for women. Tertiary education is very important. Primary education exists, however, for women to gain power in Africa, they have to be educated. It's not simply, providing lip service to women, talking about empowerment, but it's giving them access to scholarships, giving them access to actual buildings where they can be educated to become physicians, to become lawyers, to become, educators and our next leaders in Africa. So that is very essential. And also, and I always use Ghana as an example, for instance, Ghana, and for the first time, we have the first ambassador in Ghana, who is a woman. This hasn't happened to the UN.
Yes.
This hasn't happened since the UN was created.
Yes.
This is a government that is very progressive in promoting women.
So examples of empowering women.
Example of empowering women. It's actually creating avenues such as universities, creating clinics and hospitals that are focused on treating women, but also promoting women as Ghana has done in various ways.
Absolutely, yes. Mr. Fosu, thank you so much for joining us, and we look forward to continuing the conversation on Health Chat, actually, which is a radio program very soon. Kwame Fosu Louis is an African policy expert and health advisor.